Good afternoon, everyone, and thank you very much for your patience.
Okay, now.
Good afternoon, everyone, and thank you very much for your patience while we've just been getting a few logistical problems sorted out. My name is Bob Quinn. I'm part of the GP Connect team at NHS Digital. I'm joined today by Michelle McDermott, who's going to be taking us through the content for this afternoon session. And we're here today to look at how we set up TPP SystmOne for handling appointments for the COVID-19 vaccination session. Before I hand over to Michelle, just a little bit about questions. We are very happy to take your questions. If you could please use the chat function that we have on this platform to do so. We'll pick those up and we'll provide answers to the questions that you raise. So let's get things underway. I'll hand over to Michelle now and we'll get into the meat of the session. Thanks, Michelle.
Okay, thanks, Bob. So hello, everybody. I'm Michelle McDermott. I'm one of the programme managers on the GP Connect team. I'm going to talk a little bit today about how to book into the designated vaccination hubs, supporting the PCN delivery model within SystmOne. So we'll get straight into it, and we will do sort of Q&A at the end. So just a quick overview of the process. You'll, if you're in wave one, you're obviously identifying your cohorts of eligible patients already, and you'll then be booking those in for appointments. GP Connect can help you with this, so it's most useful where you have a mixed supplier primary care network, but you can also use it if you're all SystmOne or you're all EMIS. And it's an option, so it's being recommended, but if you already have a solution in place, you don't have to move to GP Connect unless you want to. I should say at this point that GP Connect doesn't support patient-facing services, so you can only use GP Connect if you're booking from one practice into another and not via your patient apps. Once you've booked those patients in, you'll then remind them that they've got appointments, and then they'll arrive for their vaccination appointment, but likely at a location that's not their registered practice. At that point, the vaccination will be given, and that will be recorded in the Pinnacle system. There are discussions with other suppliers, but for day one, next Tuesday, we will only use the Pinnacle system, and that's called Outcomes for Health. And that system will then automatically populate the patient's registered GP with the vaccination information given. So there's no intervention from you guys required. The information about the vaccination that's been given will be coded directly into your records using that Pinnacle service. And then after the patient's been given the vaccination, there's a 15-minute monitoring period for some patients, but you know, drivers need to specifically be told that they shouldn't drive for 15 minutes after the vaccine. So I'm now going to talk about how to actually book a patient into a vaccination appointment within a PCN using the SystmOne system. So this process does require that the designated vaccination site has already set up their appointments. Once you've had confirmation that those appointments have been set up, you need to, in the SystmOne practices, enable your consumer to support that booking. So what you do is you go to setup on the top menu bar, users and policy and organisation preferences, and then you select GP Connect from the list and consumer. Now it's likely that when you set up your appointments to share with 111, you've already configured your provider, but most practices haven't yet started to use their consumer in GP Connect, so that's why it needs configuring. So you select that consumer option, and then you ensure that the enable GP Connect appointments consumer tick box is selected and that it's gone blue. And then you click the plus sign under organisations to add organisations who you want to book into. Okay. So within that menu, then you select the organisations who you want to book into. Now, for most of you, this will be a single site delivering the vaccination on behalf of the PCN. But for some PCNs, you've got multiple vaccination sites. So depending on your setup, you'll choose to share the number of practices and you'll choose to select them in this group. So add in any of your designated vaccination sites, be that 1 or 10 for your local PCN, add them into here. And it will then mean that you can look for appointments with those organisations. and then select OK once you've added the organisations that you need to. So now we've set up the sharing part, we need to book our patients into a vaccine appointment, or 2 vaccine appointments. So within the patient record, so you have to search for a patient specifically. So you're booking a specific patient in, you select appointments, visits and tasks from the clinical tree. From there, you select the third-party appointments tab, and all the appointments already booked for that patient in an external organisation will be displayed. So you can see in this middle section here that you've got your appointments that the patient's already got booked at all the other organisations. That may be blank, but if there are any, they will be shown here. To book a new appointment, you choose the third-party appointment selection from the top menu, and then you edit the dates. So you choose a date range. You can only search within a 2-week window. So where you're going to book patients in for vaccine 1 and then vaccine 2, you'll have to apply 2 searches. So we'll search a date range, choose the organisation from the drop-down list of the organisations you've just added. So where do you want to book the patient in for their vaccine, and then click search. And the search will then show you, as per this screen here, all the available vaccine appointments. It won't show you any that are unavailable, so they've been booked by somebody else. It will only show you anything that's available to book. Okay, so you then select the appointment slot that you'd like and complete the details. So, the booking reason for the vaccine and any other information you might want to pass on to that vaccination site. The system may then prompt you to register the patient. And that's if they've not already been registered. Now, this only provides a temporary registration. It's a short-term temporary registration, and it will automatically deduct. But the patient, you may get this flag if the patient's never attended that site before, which is quite likely given the current scenario. If you do get this pop-up, make sure that you click yes to temporarily register that patient at the unit, and this means that they'll be able to be booked in for their appointment. So a couple of things to remember. The patient needs 2 appointments. Most designated sites are setting up their vaccine 1 and vaccine 2, so you'll need to book them into 2 different appointments. You'll have to do those in 2 separate search windows. So if you want to book the patient in within the next 2 weeks, you can search for that 2-week period. And then for their second vaccine 3 weeks later, you need to search for a 2-week period in the future. But you will only ever be able to have 2 weeks of data returned to you at any one time. So appointment 1, do a search, book it. Appointment 2, do a search, book that separately. You might have disabled text reminders in the first wave of the pandemic. Make sure that you reinstate them here so that you can remind patients of their appointments. And then all sites within the PCM will need to configure their system before you can see the appointments across the system. So the vaccine site needs to set up their appointments first, and then your site needs to make sure that you add those organisations to share, and then you can book into their appointments. But if you miss that consumer step or they haven't set up their appointments, then nothing will be visible. You can find further information from NHS England, including the enhanced service spec, at the link shown on screen, and them and NHS Digital are pushing out information via the primary care bulletin, so do sign up if you haven't already. And then just a final couple of things, we will send the slides to you. We are making recordings of these sessions which will be shared. We're updating the GP Connect website, and you'll be added to a Microsoft Teams site so you can communicate with us directly if you have any questions or any problems setting up. And we also have a Twitter page if you want to follow us. We're circulating information on Twitter as well. Okay, so Bob, do we have some questions?
We don't have any questions at the moment.
Okay, so just a reminder about the Q&A function. You can type your questions in and ask them, and we can answer them here. We'll give everybody a couple of minutes for that, but if there aren't any, then we can always take them a bit later if people think later. Okay, I think we have a couple now, Bob.
We do. Mark has asked, how does the PCN site set up so the site is shown to the consumer?
So we've done another webinar, Mark, depending on whether you have an AMIS site or a TPP site. There's two different sets of instructions, but the appointments need to be set up to shared via GP Connect, and then once you've done that at the designated site, then you can see them in the consumer. You will get details of all of those sessions, and I've currently got the egg timer of doom on YouTube trying to get the recordings online. So certainly today you'll be able to see all the different flavours of webinars, but there's a specific one on how to set up your PCN site if you're the designated VAC site.
Thank you, Michelle. Ben Bishop has asked, is registering patients as TR at vaccination sites a legal requirement or a GP Connect requirement? Most PCNs already have agreements in place to see each other.
Yeah, so it's not a legal requirement, it's more a GP Connect thing. So to create that legitimate relationship that allows you to book from one system into another, you have to temporarily register them in the background for GP Connect to work. So that temp register allows then a booking to happen at the patient's non-registered surgery. So it's less about agreements of PCNs and more about the technology behind it to allow booking from one system into another.
Thank you, Michelle. We have a question relating to vision sites. For a PCN with a vision site booking into a TPP site, how do they do this? Someone mentioned the workaround where the vision site logs in as the TPP site, but if that's the case, how do they access their own patients to book in?
Yep, so it's certainly not a perfect solution. Vision don't have the ability to book into other people's systems at the moment, so the vision practice would have to manually do that within the TPP site if you were to allow them to log in. So there's not a clever way of them searching their patients, unfortunately, but you would, in order to be able to see their records, you'd need them to include the NHS number so that you were able to search for those patients if you needed to look at their record. If you want to drop us a note separately, perhaps we can get our regional contacts to talk you through that as well.
Super, thank you. Next question up is same appointment process required if we upload appointment rota on SystmOne hub unit?
So SystmOne to SystmOne does have an appointment sharing function, so you don't necessarily need to use GP Connect, but if you have any EMIS practices in the mix, you would have to use GP Connect. You will probably all be familiar with how to share appointments across SystmOne, but if you're using GP Connect, then it's, as we've described today, and you need to set up your GP Connect provider to share the appointments in the same way you do with NHS 111.
Thanks, Michelle. Next question we have, when we register as temp at vaccine site, will it affect the record in SystmOne in any way?
No, it's just to allow that appointment booking to happen, and as I say, it automatically deducts after, I think it's 14 days after the latest appointment, so you don't need to do anything. It just it's just a background step to allow that connection between the systems.
Thank you. Anne asks, can we use remote booking to book into these appointments?
So you need to choose one or the other. You either use remote booking or you use GP Connect. And if you have a single system, then you can choose either. But if you have multiple system suppliers in your region, then you need to use GP Connect to allow them to book in across systems.
Thank you very much. Next question we have is, where will the text reminder go from?
So there's you have options there. The likelihood is it'll go from both. So when you book it, you'll send an SMS to your patients to say that you've booked the vaccination in, but then a reminder may also go from the vaccination site.
Thanks, Michelle. We have a question here about payments. Often comes up. Are you able to give detail on how the payments will be made to each practice?
Not at the moment, but I'm hoping that I have some answers on that around 2 o'clock, so we should be able to send something out afterwards.
Thank you. A Question, can you set up so both EMIS and SystmOne practices can book into?
Yep, so there is a setup webinar. Once the designated vaccine site have set up, then both EMIS and TPP practices can book into that designated site. So the whole point of GP Connect is that we can share appointments across suppliers.
Okay, next question. Do you need to have clinics set up for each individual vaccinator for access to records reasons?
So no, but you can. So it's really individual choice. We have some practices running one list, we have some practices running 5 lists. So you might have 5 rotas set up, but equally, you know, some practices now are setting them up with vaccinator 1, vaccinator 2 as dummy GPs. You don't need the actual clinician running the vaccination clinic to be listed. They do need to be a GP Connect enabled clinician, which is in the other webinar, but you don't need to have it that it's the actual person delivering the vaccination. As long as the person delivering the vaccination is logged into the clinical system, then you'll be able to see the record. So there's no real concern with using dummy clinicians in that context.
Thanks, Michelle. A question here about Accurex. Is this the only solution? Accurex had a solution to allow patients to book remotely, taking pressure off the already stretched reception staff. I've also been informed that these appointments may be booked elsewhere. Is this accurate? Reception don't have capacity for this massive piece of work at the moment.
So there are other solutions being explored, but none of them will be ready for Tuesday. So Accurex and other suppliers are in discussions with NHS Digital. Something has been posted on the Futures Forum by Mary Hudson, just explaining where we're up to in terms of requirements. But if you're in wave 1, then you need to use what's available now, because the Accurex and other solutions will not be ready for Tuesday.
Thank you, Michelle. Question, presumably this is only for practices hosting all patients. If we are just using premises but managing own staff and patients, we can use our own SystmOne?
If your delivery model is that each registered practice vaccinates their own patients, then you don't need to share appointments across the PCN. But if you are having designated vaccination sites as per the PCN model that's been set out, then you should have those appointments available to all practices within the PCN. So, but if you're solely sticking to your own practice, vaccinating your own patients, then you don't need to use this kind of tool. But I think currently the vaccines themselves are being delivered to a designated site. And so the idea is that designated site does all the vaccinating, and therefore you have the appointment book hosted at that designated site.
Thanks, Michelle. Kerry asks, when trying to book an appointment, it is bringing up an error saying the telephone number of the patient is not recognised. Check number and it is correct. Any clues why this would be happening?
Sometimes it throws a little bit of a fit if there's like a special character or a like a bracket or something included. So just check and maybe make sure it matches PDS, and if not, get PDS updated with the right thing. Sometimes it throws a bit of a wobble when there's incorrect characters in there. But if you're still not getting anywhere, then send us another note with your contact details and we'll help.
Hopefully that'll help you out there, Kerry. Further question, how does this work with the self-booking system that patients use for vaccine bookings?
So it doesn't work with the self-booking system. GP Connect, as I mentioned at the beginning, is only initiated by practices. So practices booking in on behalf of patients. It doesn't work for patient-facing services. Thank
you. Could appointments be booked outside the patient record, or do we need to open individual patient records to book appointments?
For SystmOne, you have to open the patient record to book appointments.
Thank you. Do you have info about how to set up SystmOne as the host site and EMIS web sites to see it?
We do, yeah. I mentioned I'm just trying to get them uploaded to YouTube, but I've got the Egg Timer of Doom. They will be available, and we are scheduling future webinars if you want to watch them live as well. So we'll send out information to everybody, and we'll mention it on our team site once those are available.
We are starting vaccinating next week. Can we have these webinars as trainers?
Could you drop us your contact details and we'll have a chat about what you need? If you just send them to us, we won't publish them. Thank you.
Further question here, Michelle. Once booked, does the appointment show in the SystmOne record, or does it only show on GP Connect?
It shows in the patient record, but it shows as a GP Connect appointment. So if you want to go in and edit it, you need to look at the patient's booked appointments and look for GP Connect appointments, and it will then show you those that are booked.
Okay. So clarification here, I think, on so patients can't book online. Admin staff reception needs to book appointments.
So patients can still book online if that's what you want to do, but if you use GP Connect in this instance, then they can't. So there's a bit of a quirk with patient facing that if they're not booking into their registered practice, you'd have to register them all at the vaccination site. But the advice from NHS England is that you don't have the patients booking their own appointments because of the various pieces of information that you need to give them. So the parts about not being able to drive for 15 minutes, the do not bring your whole family with you because they're not going to be allowed into the practice. But equally, if you are over 85 and you need accompaniment, then they can come, but they need to stay outside. There's also the potential chaos that could be caused by patients booking into 2 appointments in the wrong time frame, which will lead to more work for the practice anyway. And there is a thought that the initial cohort of over 80s probably aren't the cohort that are that concerned about digital transactions and would more likely respond well to an approach from their practice rather than being asked to book in themselves using digital services.
Thanks, Michelle. I think that's clarified that. Ben Bishop has asked another question on temporary registration. Is it as easy as ticking yes when reminded, or is there any manual detail entry required by admin teams?
No, it's as simple as ticking yes, and then that's it. It does it for you in the background.
Thank you. If all our 3 sites are SystmOne, do we need GP Connect?
No, you can use SystmOne sharing for appointments, or you can use GP Connect. It's entirely up to you. But if you already have SystmOne sharing set up, I would suggest you carry on with that.
Okay, we've got someone asking if you could go back to the booking of the appointment. I don't know if we could quickly go back to that section of the presentation, Michelle, just to clarify that.
Yeah, sorry, it's just a bit slow going backwards. So, okay, I think it's just loading for you. Okay, so when you're booking an appointment, you go into the patient record, select the appointments, visits and tasks option from the admin tree, select the tab that says third-party appointments, which is over here, and then all the appointments that you've already got booked for that patient will show. So if you'd already booked them into a vaccine, it would show here. But if you haven't, you can select the button to book, choose the organisation from the list that you created earlier, select a date range for when you want to book that appointment in, and then do a search, which brings you back this screen here with all the appointments as a pop-up that are available. You click on one to book it, and you can also change your search criteria if you want to. Click on one of the options, and then it will ask you to fill in the details, so a reason for the appointment, which is fairly simple in this case, and then it may prompt you if they're not already temp registered, and if it does prompt you, just click yes, and that will then book the appointment.
Thanks, Michelle. Hopefully that's answered that particular question. Someone's asking if we can give the link for the website to access webinars. We'll share all relevant information with people after the call, so we'll certainly do that. We've been asked, how do we register for Pinnacle?
So if you're in wave 1, that's already being coordinated by your CCGs. I'm hopeful that this afternoon I'll find out some more information on waves 2 and 3, and then we'll be able to publish that. And there is some Pinnacle guidance which we'll make available to everybody as well. Okay,
we've been asked, do we have step-by-step instructions on how to set up SystmOne as the provider?
Yes.
Yeah, we'll get that information out to people after the call, essentially. Question about SMS services. How do we set up SMS services from the Federation or PCN SystmOne system?
So I need to come back to you on that. I have a couple of SMS questions that I need to clarify. So let me come back to you on the SMS questions.
Thank you. Do all vaccinators need logins for the vaccination site clinical system?
Yes. If they don't have logins to the clinical system, they won't be able to see the record.
Okay. We've had a request for a recap on how to set up clinics on the system.
So we haven't done that today, it's in a different webinar, but you will get sent the information to all of the various webinars that are available, so you can watch those back, and there will be some scheduled as well in the next few days, so we'll also send details out on those.
Okay, we've been asked, are we sending out a guidance sheet? Yeah, this all of the information that Michelle's taking you through to get things set up will be sent out after this call. How do we cancel the appointment if we have to? So
I'll just go back because it's easier to show you. But when you go to the appointments, visits and tasks from the admin tree and you select third-party patient appointments, you also see any appointments that are booked here. You can select one and press the cancel button, and it'll then ask you for a cancellation reason. So you effectively go into the patient, have a look for their third-party appointments, and you can cancel them from there.
Thanks, Michelle. I don't see any further questions on the chat. Guess it's an opportunity to ask people to final opportunity for questions, or if we've missed anything, please flag that up to us. There will be opportunities for us to respond to things we've not covered directly. As we say, we'll get information out to you after the call to help you get things set up.
There's one from Anne Bob. So do the patients being booked in require to have consented to share their record? If they haven't consented to share their record, the implication is that the vaccinator might not be able to, well, won't be able to see their record if they're in a different unit. And that may then delay or prevent the vaccination depending on their individual circumstances. So it's worth noting the implication for patients, but of course, they're not obliged to agree to share.
Thanks, Michelle. We do have another question. It's not clear to me how patients are going to booking into the delivery site. Who does the patient call to book in for a COVID vaccine? Who sends out the text saying they are now eligible to get a vaccine, and who do they call to get booked in?
So the patient's registered practice is responsible for call, recall and booking the patients. So as the registered practice, you should be contacting your eligible cohorts of patients, which SystmOne have provided searches to be able to identify those patients, and we're hoping to share some information on those as well. Those patients get contacted by the registered practice, and you then book them into the vaccination site, be that your own site or a different site within the PCN. There is also the National Call Recall service, so there is a chance that patients could be contacted twice, but National Call and Recall is not really being used for the PCN delivery model. It's more for the mass vaccine sites and the hospital trust vaccine sites.
Thank you, Michelle. A question, can we set up question as reminder so it pops up at the time of booking?
Can we set up? Sorry, I don't know what that means. If you could clarify, I'm happy to answer, but I don't know what you're asking, sorry.
Okay, I have another question here, Michelle. Enos have just said something about NHS England organising call recall centrally. Do you know anything about that idea?
Yep, so I just mentioned that National Call Recall does exist, but it's largely to get patients into those mass vaccine sites and into the trust delivery vaccine sites. Now, they're probably not relevant for the first cohort of patients. You know, care home staff and patients and the over 80s are more likely to want to go to their registered GP, and that was definitely the tone of the messaging last night from Nikki and Ed on their webinar. So National Call Recall does exist, but it is really going to focus on the mass sites. the worst thing that would happen is the patient gets 2 communications, and that's surely better than none.
Thanks. We have a few more questions coming in, Michelle. Third-party appointments is not showing on our records. Is there a setting we have to change, or how do we access this?
So it's likely that your vaccine site haven't yet set up their appointments, so there's nothing for you to see. So that was why I said at the beginning, they need to set up their appointments first, and then you can book into them. So it's probably worth checking with them where they are on their setup.
Thank you. Question about the TPP reports. Can you please inform what the TPP reports are called?
Yep, so I'm just talking to TPP about the various options, but I will share the information that they've given us. It's not one report, it's quite an extensive set of different things that you can do, so we'll make sure that that's shared. Thank you.
Will the clinics be set up on the vaccination site's clinical system?
Yes.
Nice short answer to that one, Michelle. Can you cancel appointments if a patient is unable to attend?
Yes, so that's on the screen that I'm currently showing. So you'd go into the patient record, look at their booked appointments, and then click the appointment that you want to cancel and click cancel and give a reason. Alternatively, you can amend, which sends a cancellation and allows you to rebook.
Okay. Sue says, presumably the third-party appointments tab only appears when the GP Connect provider consumer bit is set up. I don't have that tab on my S1 currently.
Yeah, that's right. So you need to set up your consumer as the people who want to book in, and then someone has to have shared appointments with you. So those things need to happen first. There was a deliberate order to the instructions.
Okay, and I think we've got a bit of clarification about the question you didn't quite understand about setting up the reminder at the time of booking. That's the question could be like, has patient had another type of vaccination in the last 7 days?
There's no reason you couldn't do that. I'm not entirely sure why you need to, but you can set up those types of reminders if you want to.
And further question is, is there a quick button to take you to the third-party appointment section?
I mean, there's always a quick button in SystmOne, but I will confess I don't actually know what it looks like, so I will ask them and let you know.
So that was the final question, Michelle. I don't know if we have any more.
I think we'll do final call and then we can answer anything else outside of the session if anyone has anything further.
Yep. So last call everyone for questions.
Okay, I'd say that's us
done. Silence.
So, yep. Thank you very much for joining, everybody. Good luck, and as I say, we'll sort of share everything that we've got, and we'll let you know if there's any further webinars to be set up, and we'll make sure that everything gets onto YouTube as soon as my egg timer of doom stops whirring. Okay. Thank you very much, everybody.
Thanks for joining, everyone. Good luck getting things set up.